check here.
Sure,
You
if you
know,
want to.
I'm board certified in internal medicine and anti-aging medicine
Thank
here.
you, I appreciate that.
And my specialty is hormone replacement therapy,
Good.
you know. And, you know, hormone replacement therapy has had a lot of bad press, you know, through the years. Unfortunately, most people and most doctors even get their news from their medical information from the news. They believe whatever it is that they've heard, you know, in the news. So like, you know, for example, testosterone and menopause treatment, there's been some bad reports. Like, can you think of it, like the bad stuff you've heard about, like the testosterone treatment? Can anybody tell me, like, what's the bad thing you heard about testosterone therapy? Anything?
Cancer.
Yeah, it could get cardiovascular disease, right? You know, that's what they say, anyway, you know, right?
For a while, long time ago.
Yeah, anything else anybody can think?
Cancer.
Cancer, prostate cancer, right? Testosterone therapy causes a prostate cancer. Why would I want to do that? I don't want a heart attack. I don't want prostate cancer, right? And how about for menopause treatment? Anything, the stuff that if you treat menopause, what's the bad stuff that could maybe?
Estradiol causes breast cancer.
Exactly, right? You know, that, yeah, this stuff causes cancer. Well, why would I want that? You know, uterine cancer or breast cancer, you know, maybe cardiovascular disease, you know, and I'll add on for testosterone, maybe some fertility type issues, you know, might be something that might be concerned. So all these things are kind of myths. People kind of generally believe that testosterone causes cardiovascular disease and prostate cancer, that if you take hormone replacement therapy, you're going to get breast cancer or something like that, right? And so that's why most people kind of avoid that, in spite of the fact that they are suffering from a lot of ways. So we're going to try to debunk some of those rumors. So one of the things I got in this because of energy. And I was like this guy, if not even worse. I mean, some of my staff remembers, I could not even get out of a chair. I would have to talk to myself, okay, there's a patient coming on in 5 minutes, I'm gonna have to get out of this chair. Okay, it's 2 minutes, I'm gonna get out of this chair now. My energy was just broken, you know. And then I stumbled on the World Anti-Aging Conference and discovered that hormones are really the energy control system. And that when I got the energy, this system back and optimized, then my energy came back, my life came back, and I said, oh my God, if this can do this for me, if it can turn my life around, what can it do for all my patients? And I found out that it was the same miracle happened for patient after patient after patient, just return of life, return of energy, you know. And so most people are suffering, you know, from the deficiencies, and they have all the symptoms, but they just don't even realize it, you know. So like, you know, energy fatigue is kind of really the one thing is most critical for most hormone deficiencies, you know. And, you know, we like to rate these things on 1 to 10 as to, you know, how bad are you suffering? You know, 1 to 10, you know, how bad is your energy compared to what like you were like when you were healthy and a youthful person, you know. How bad is your mood on a 1 to 10? You know, how bad is your sleep, your focus, your libido, hot flashes? Because all these things kind of start to suffer as the hormones go down and your quality of life kind of goes down. So how you feeling as far as that goes? You feel like maybe your energy could be better? Anybody feel like you're like that guy in a chair? Like, oh my God, yeah, right? Like, yeah, like, but the hell, I want to do something, but my body just refuses. I found that energy was just the key, because if I didn't have energy, I couldn't do anything. I couldn't even like think or talk to people sometimes. Like, you know, couldn't do my exercise, I couldn't do my work, you know. So energy is really critical. And so these are some of the symptoms that people have, you know, in terms of just hormone deficiencies. It can involve, you know, fatigue and moodiness and problems with sleep and wet brain fog and weight gain and hot flashes and libido. You know, all those are potential symptoms of hormone deficiency. Anybody got any of those symptoms?
Not anymore.
Yeah.
I've got a lot of them.
Right.
When I quit, yeah.
Yeah, right. You know, so, but the thing is that, you know, people are used to accustomed to living like this. Like, well, I'm getting old, so my energy's worse. You know, I'm getting old, so my mood's not as good, my sleep's not as good, my focus. They just want to attribute it all to age, right? But the strange thing is that it's a reversible condition. That these symptoms are, and in the old days, I would just, you know, band-aid somebody. You know, you can't sleep, you're Ambien deficient, you know, your mood is bad, you're Prozac deficient, you know, or your energy's bad, you must be depressed, take an antidepressant, you know. And I felt like I was just kind of only band-aiding the issues. Wasn't really kind of getting to the root of the problem. And then I found that hormones were kind of at the root of the problem. So that not only did those bad symptoms go away that people were having, but all the illnesses that I was trying to prevent and treat with these pills also started to go away. All the symptoms started to go away. And I found, wow, this is really the magic. It's the hidden magic. But you know, the world is so paralyzed by what we see in terms of the news, and they believe what they see in the news, that most people are afraid to make the shift. So by kind of really energy is the root, and hormones are the basis for energy and for metabolism. And they work different than all those pills that I was telling you about that most people prescribe. Because a pill makes a little enzyme work better, but doesn't give you more of that enzyme, more of that cell, more of that body part. You need the control panel, the DNA, to do that, and that's what a hormone does. Those are control panel. So example, for a testosterone, turns a child into an adult to give them better brains, bones, muscles, cardiovascular system, quality of life and health, so they can survive and potentially reproduce in an environment that might be trying to kill them. And as you move out of that reproductive area, the body says, to hell with you. Let's take away your brains, bones, energy, quality of life, because we don't need you anymore, you know, but we don't have to do that anymore. We keep you around for a little bit longer, improve your quality of life, or prevent all those illnesses of deficiency, you know, and then if you don't get heart attacks or cancer or diabetes or cardiovascular, you don't die that quickly. So, you know, the goal is, in my practice, is to improve your quality of life fairly quickly, to prevent all those illnesses of deficiency that are occurring, and therefore give you a longer, healthier life. And that's what we shoot for every day in my practice. So this is testosterone. I was going to think, well, wait a second, this is testosterone, this is a male thing here, this got nothing to do with me. Well, it turns out that women actually have testosterone and men have estrogen. We're not quite as different, you know, as you would think. And so the problems I'm talking about, I'm going to start out with men, but I'm not going to forget about women, right? Okay. So this is testosterone as it goes over time. You know, as you see, it obviously naturally declines over time with age, but how healthy you are depends upon how good your testosterone level is, because you start out with a good level in the 1,000 areas there, you're much less likely to die than if you start out here in your 200s, you're much less likely to survive, all right? So do you want you to be down over here in the low risk, to the likely to not live, or you want to be up over here in the likely to live category, you know? So it can make that much difference. Whether you live or die can be depending on your testosterone level. Right? And so this is the same thing for women, you know, so women actually, you know, do have testosterone, and they develop exactly the same condition that men have, but women don't realize it. You know, starting at about age 25, their testosterone level peaks and it declines thereafter. And symptoms of testosterone deficiency are gradual decline in energy, tendency towards weight gain in the middle, anxiety or depression, poor sleep, brain fog, and diminished libido are kind of main symptoms. You guys got some of those symptoms? Yeah, right. You know, most people have all of those symptoms. Like, oh, gee, I thought that was just getting old. My energy's not as good. But turns out that we can really improve all of those quality of life symptoms, plus help you get healthier and prevent diseases. So women get the same symptoms, but you know, most guys don't realize it. But you know, their wife or significant other, by the time they're 40, well, they're kind of like the guy, less interested in sex, putting on more weight, you know, losing their energy. But we can actually reverse this process. So most doctors practice like this when it comes to blood tests. You know, if the test is in the lower 2% or upper 2%, they might be interested. But for the 96% in the middle, you can move way down over here and have all the symptoms of the deficiency, like decline in energy, mood, sleep, awakening. That's considered normal. When I want normal for my patients, I want optimal. Optimal is in the higher to the range where people function their best in terms of their quality of life, but also in terms of preventing diseases and in terms of longevity. So I don't want normal, but optimal for you. And when it comes to testosterone, it's pretty tricky, because at this level on testosterone, for a woman is like a level of 2, because if you're 1, you're abnormal, right? Whereas my optimal is 150. So, you know, pretty much every woman is told that their testosterone level is normal. You know, right? You know, and most men are told that their testosterone level is optimal. Go home. There's nothing we can do for you. Go home and be tired and put on weight and develop disease because your level is normal. You know, but we don't want normal. So for women are a little trickier. For men, we just have like a slow downward course of testosterone. But women also have progesterone and estrogen. Those deficiencies develop a little later. You know, this one more about the 40s. This one more about, you know, the 45 to 50-ish. You know, so for, you know, first we treat testosterone, then we treat progesterone, and then we treat estrogen, because all these hormones are involved in the control
Yeah,
panel.
I just seen
The control panel is one that really controls your general metabolism, how you feel, your quality of life, and protection against disease. So this is how we want, we want to kind of get that energy back, and testosterone itself is energizing and motivating. So if you take advantage of that, you can really double or triple your results. You get back to the gym, your energy's better, so you get back to the gym, you feel better, so you eat better, your brain is working better, so your work is better, your mood is better, so your social life is better, your weed is working better, so your sexual life is better, basically all the quality of life kind of gets better. So, when it comes to the hormones, there's actually, 7 different hormones involved in the control panel. And we look at all of these in the people that come in for the basic blood work, because, they're all interrelated. And if I just only teach testosterone, but I don't look at all these key hormone systems, then I'm not going to really kind of get you to your optimal level in terms of your quality of life, your metabolism, your weight, your internal health. So these are the ones that's testosterone, thyroid, and I want your thyroid not normal, but optimal. On the higher end of the curve where people function the best. And then estradiol, really critical, and then progesterone, vitamin D, growth hormone, DHEA. All these are kind of metabolic stimulants. So when your metabolism is stimulated, well, it helps the energy, mood, sleep, because your system, but also weight burns off much more easily if you have these hormones working for you as opposed to not working for you. Now this one is for men, because I don't have one of them for women, but for men, unfortunately, women have not been really well studied. They've been hardly neglected by the medical profession, so that, a lot of the studies, have not been duplicated for women, but I'm not forgot about you, there are some things we can do. But for men, this is a testosterone level, and my optimal is over 900. This is, and normal is going to be like down over here for what most people would say. But at 900, you see it says Alzheimer's disease there, right? Because the brain most sensitive to testosterone is most highly metabolic tissue. So that as you lose your testosterone, well, your metabolism slows, weight builds up in the middle, and your brain starts to not work as well, because testosterone stimulates brain tissue. Your risk of Alzheimer's disease, is Alzheimer's disease, your risk of Alzheimer's, if your reading is over 900, is only 0.2. But if you go down over here, your relative risk is 53 times higher down over here. The lower it gets, the dumber you get, unfortunately, right? Right? But the good news is the higher it gets, the smarter you get, because testosterone implicated in making new brain cells for men and for women. Now, I don't have numbers for women, but it's the same kind of pattern that, at the optimal levels for testosterone, your brain function is best. As you lose your testosterone, well, your brain function not as good, so. And then over here now, you don't have to worry about prostate cancer, but see, it says prostate cancer. Well, below this level, your risk of prostate cancer goes up, because little known fact, testosterone partially protective of prostate cancer. I'm going to show you the data on that a little bit later. And then over here now it says mortality, because if your level is below 600, your chance of dying is 49% higher, but if you get it back above here, it's a reversible risk factor for death. Back above 900, your risk becomes less than average risk of dying. I'm literally throwing you a lifeline to save your life if you take this. So this drops further. Now over here, you can already have pre-diabetes up over here. Now you get full-blown diabetes. Testosterone deficiency causes diabetes, right? It causes the weight gain in the middle and eventually causes diabetes. And as you get further, now here's what most people really start to know the symptoms, 400 or less. That's where the fatigue, the moodiness, the libido issues kind of really start to happen. Now in women, it's kind of similar that, higher levels, it protects against Alzheimer's disease, protects against diabetes, and it starts to get really low. Then, we start to see issues with more fatigue and loss of libido and moodiness and stuff like that. But this is an average number and a continuous curve. The higher the level, the better the energy, the better the mood, the better the sex function. And so I want you enjoying life and getting healthy up over here, not struggling with life and getting unhealthy down over here. So then as it goes lower, your heart can sludge up. Now here it says coronary heart disease over here. I thought we said it causes coronary heart disease, but if the level's less than this, and it is higher risk for cardiovascular disease, you want to get it over here to prevent cardiovascular disease. I'll show you more data on this later. So here your mood is crap, you can turn into a real bitch, where you can stop working. Well, we don't really want to go that far, you know. So I want to kind of get you to the optimal level where your health is best, and also your quality of life, like energy, mood, and sleep is best, your libido is best, everything is best. So here's some of the data, like why would you take this stuff? Well, if you didn't want to get diabetes, that would be a good reason. Because it's been shown to actually prevent diabetes, turn pre-diabetes into normal, and turn diabetes into pre-diabetes. Testosterone is partially protective of diabetes. And in fact, it actually was also protective
Just pointing out
of
the
life.
diabetic in the room.
Yeah,
The diabetic in the room.
right. Is that if you had diabetes, you would really want to take testosterone, because if not, you die. This is right. This is how much people who on diabetes who don't take testosterone. This is how much they live. And it's people who do take testosterone. There's a dramatic difference in survival in diabetics that take testosterone and diabetics that don't take testosterone. And this is if you just wanted to kind of live in general. You don't have diabetes, but you don't want to get cardiovascular disease, because we said testosterone causes cardiovascular disease, but not actually. Administered properly, those that had the higher levels of testosterone actually got significantly less cardiovascular disease. And the same thing would apply in general, I think, for not all the studies have been done, but its effects are positive. You know that the blood vessels are muscles, you know, so testosterone improves muscle function, so helps in terms of artery function, in terms of the contraction of the heart muscle. The heart is a muscle, so testosterone improves muscle function. So what about this prostate cancer thing? Is the myth that testosterone causes prostate cancer, but actually it's not at all true. In fact, they've done studies where they've given people that have had prostate cancer. Now there's two real kinds of prostate cancer. There's the really aggressive kind, which is kind of rare, and there's the kind of less aggressive kind. The real aggressive kind, no matter what you do, you're going to not do well if you take testosterone, or you don't have testosterone, unfortunately. But you have the less aggressive form, then most people actually live longer if you give them testosterone than you don't have to get testosterone. It actually helps for the low-grade prostate cancer. It also helps to prevent the low-grade prostate cancer. So that myth is just totally untrue, because it's based upon actually one study in 1947 is where that came out to, but they did that carried forward for the next 50 or 60 years over there. That one patient had it worse with testosterone, and now it becomes like everybody believes that. So then, so then testosterone again predicts whether you're going to live or die. You know that if your level is low, it's not too good. But you can fix that. If you actually fix your testosterone level, it can return to lower risk, you know, for death. In addition to not only death and diabetes, but just your whole quality of life. But also, you know, in terms of Alzheimer's disease, now we don't have data on women, but testosterone is really important for women, and also estrogen for Alzheimer's protection. And they've shown pretty well that, you know, the lower your level of testosterone, the higher risk that you're going to get something like Alzheimer's disease. So, but what about, you know, the problems, the side effects? Well, we talked a little bit, you know, about the potential risks. So, well, if you take testosterone, your estrogen level can rise, and high estrogen level can have some potential ill effects on the system. Now, there's a lot of them, I call them cowboys out there, that they get testosterone off the internet, and, you know, they just give whatever they want, and they're not checking their red blood cell count, they're not checking estrogen levels, you know, and they're not looking how much are they giving. And well, then I think those people are kind of set up, because there are things that really could cause problems, you know, and high estrogen levels, well, nobody wants man boobs, you know, but it can, you know, it can affect your sexual function, and higher cardiovascular risk. You know, they say all those bodybuilders, they get cardiovascular disease. Well, if you take 3 times the dose I recommend, and you never check your estrogen level, and you never treat your estrogen level, well, you're kind of setting yourself up for cardiovascular disease. And then also high risk of prostate cancer and benign enlargement of the prostate. So that's why we recommend that, you know, that you don't be a cowboy, get it off the internet and not know what's going on. This stuff needs to be monitored, because it can cause this, but also it can cause elevation of red blood cell count, which also is can raise cardiovascular risk, can raise blood pressure, you know, so estrogen can raise cardiovascular risk, and the red blood cell count can raise cardiovascular risk. So you do all this stuff, you're not checking all these things, while you are kind of set up, that's why this whole myth kind of gets started. But we can show that given the right doses, the right people, that actually does the opposite effect of that. And then, so then there's what happens if you take testosterone, what happens if you don't take testosterone, and this is kind of what you're looking at. Well, you know, testosterone is a metabolic stimulant. If you've got belly fat, you're testosterone deficient. Testosterone is my #1 belly fat burner. All the key hormones affected, like testosterone, estrogen, growth hormone. But the #1 deficiency that causes belly fat is testosterone deficiency. I can see some people that got testosterone deficiency here. I'm pretty sure I don't even need a blood test.
Oh, wow.
You know?
Point him out. Oh my God.
But also protective against pre-diabetes, against osteoporosis, cardiovascular disease, dementia, and sexual function. So, well, you can have all this, or an elevated red blood cell count and elevated estrogen we can easily fix. So the side effects, relatively minor, compared to all these illnesses you're setting yourself up for with testosterone deficiency. So then, what about women? So now women much more likely to get Alzheimer's disease than men, you know. And there's two main deficiencies, testosterone and estrogen have a lot to do with those deficiencies. You can see there's at least a double risk for that. So it's really important that women, you know, fix testosterone, which helps the brain function, but also estrogen. And this is what happens during the menopausal period for women, that, you know, first they develop a progesterone deficiency, and they get problems with insomnia and anxiety and hot flashes and stuff like that. And then the hot flashes start to really get bad, and the periods start to get irregular. And then they're developing estrogen deficiency, and then they're starting to really feel bad. And then, so then over here, then you can see that what happens as they start to get worse, well, the brain function starts to get worse during this period, because estrogen and progesterone and testosterone are all really critical for brain function. So you start to get this brain fog going on, hot flashes and moodiness, and you start to feel pretty miserable, you know. And then metabolism goes, and the weight starts to build up in the middle, and it starts, then I put this weight on, I'm tired, so now I don't want to exercise, and the whole cycle starts to get worse. You don't have the energy. So this is brain function over here. Now, ideally, what happens is that we see a decline, especially when you get into menopause, is the brain of a woman really needs estrogen for function, you know, but also testosterone. So that if you get if you don't get it, then there becomes a decline, and becomes an irreversible decline, you know, after about 5 to 10 years. But if you maintain those hormones, then you could potentially maintain your function, help prevent things like Alzheimer's disease. And what about osteoporosis? Well, testosterone and estrogen deficiency really critical for osteoporosis. Women more susceptible to osteoporosis. So it is actually the best treatment in terms of osteoporosis. Improves bone density by about 10%, and also protective for things like diabetes in women also, as in men. So then what about this cancer stuff? Like, doesn't it cause cancer? I'm sure I heard that. Well, and that was the old study back in 2000. It was a bad study. You know, they didn't really use the right drugs. They used horse estrogen and Premarin, which is an anti-progesterone, and they gave it to people like 65 and up. But menopause starts at 55 or 50, right? So they waited maybe 10 years too long to give them the wrong treatment by mouth, and they got very bad results out of it. And because of that, this was around 2000, a whole generation never got hormone replacement therapy. They heard it was bad starting about 2000. So everybody in my age category, that's people in the 60s or whatever, we heard this stuff was bad, so stay away from it. The fact is that there's been a lot of studies since then to really show that what they did was not correct, that if you do the right treatment with the right people, that results are really quite the opposite. So there's a couple of studies. This was called the Dayton study, and they had 2,000 patients over 10 years. They gave them testosterone pellets or testosterone injections, and breast cancer was reduced by 39% in this group over here. And they did another study, the BioT study, another 2,000 patients over 10 years' time. And again, it was a 35% reduction in breast cancer. So if you don't get breast cancer, you don't get osteoporosis, you don't get Alzheimer's disease, you don't get cardiovascular disease or diabetes, you're not dying very quickly, you know, so, right? So, you know, that's what my goal is, to try to help those quality of life things like your energy, mood, and sleep, that, you know, get you back to an active lifestyle, prevent those illnesses of deficiency, and give you a longer and healthier life, and safely by monitoring what's important. All right, so that's basically it. Any questions then?
So you don't go with, like, there's an average, well, at your age, this is kinda average.
No.
You give me the, like you say, optimal.
Optimal for
Like
any
that,
age.
Like you're 20.
Like a 20-year-old. I want you to be like a 20-year-old in
Right.
terms of your energy, mood, and sleep, you know. And we get pretty good success in terms of rolling back the clock in terms of how people feel, you know. And then, you know, once they start feeling better, well, then the lifestyle starts to improve too. I'm feeling better. I got some energy now. I'm going to work out. I'm feeling better now. You know, I'm going to start eating better. And it's a progressive process. I got people in my practice now 10 or 15 years that every year they're better. You know, their weight's better, their sugar's better, their inflammation's better, their exercise is better, their quality of life is better. You know, people just coming in is that they're like, you know, sitting on the couch and they're running marathons or they're kickboxers. You know, just you know, just really. And one was just 50 years old. She's a college professor, and then she got on hormone replacement therapy. Now she's running for the college. You know, as a long distance runner. So I've seen really huge turnarounds in people, miraculous turnarounds, and that's
Right,
what
it gives you the energy to keep moving, and then
Right.
that's the.
You translate that
That's
to
the reason to live, that you'll live longer. But yeah, my mom,
Mhm.
she had, Alzheimer's. Yeah, she passed from it,
Mhm.
so.
Very common in women, you know, and
She's
very,
the only one in the family that.
very treatable, you know.
It's not just energy too, it's drive.
Yeah, the motivation, yeah,
Right.
and you know, to get there, you know, and you get those energy motivation together, then you can really double or triple your results. You know, now you got the energy to go to the gym, and you're getting results there finally, you're putting on some muscle. So I think I'll stay there a little longer. I got some energy, I'll work a half hour longer. You know, that's kind of driven me through.
Yeah, your attitude, when you get to the gym, you
Yeah.
want, you're more enthused about
Yeah.
working
Right.
out.
When you see results, it makes it worth it.
We see results, right? You're fighting with bad metabolism like most people are, you know. The best you do with diet, you're just not making any progress. And the best you do with weight, well, if I'm not getting results, why should I eat like this? You know, just, you know, pass me the donuts. I don't care anymore, you know?
And now I just look at the couch as a routine, like I wanna take a nap at noon, but I don't really need to.
That's the-
You mentioned like, and I don't know a whole lot about it, but you mentioned pellets and pills and
Okay.
injections. And,
Sure.
I mean, how do you typically, is it just different for everyone? Or
It's
what-
different, yeah, no, good question, thank you.
What are pellets anyway?
Right. Good question, thank you. So then, it depends on whether it's a man or a woman, you know, as to what the options are, but let's talk about men first. The main options we offer are pellets. They're small like rice-like structures there that are testosterone, and they're a slow release over about a 4 or 5 month time period. So with those, what we do, generally we put them in the fat of the butt or the fat of the flank area. So we numb stuff up, you know, we make a tiny incision, we put pellets in the fat of the butt area, the slow release over about a 4 or 5 month time period. With that, we get great improvement in terms of quality of life, in terms of metabolism and weight control. So that's for men. Now, the other option for men is weekly injections that you do or a significant other does. And with that, we also get really excellent levels in terms of testosterone, but not quite the steadiness that you get with the pellets. There's a little bit more highs and lows out of that. And because of the highs and lows, there's a little more tendency towards estrogen elevation and towards red blood cell elevation. So we kind of got to watch a little bit more closely for those side effects. But significantly less expensive, you know, than the pellets for a man. For the man, the pellets are about $650 every 4 or 5 months. With the injections, if you stock around for testosterone, you get a vial for about, you know, $50 or something like that. So you might go through maybe 2 vials in 4 or 5 months. It might run $100 or so in supplies versus the $650. But with 20 shots in the butt or the thigh, if you don't do the shots, well, you're not going to get the results depending upon your compliance. A little bit more monitoring required in terms of red blood cell count and estrogen. Now for women, you have pellets, but if you're actually in menopause, there's not only testosterone, but estrogen involved in the pellets. You know, and so that's, you know, about every 3 to 5 months. It depends upon your activity and metabolism with that. And we also see great improvements in terms of fabulous improvements in terms of quality of life, like energy, mood, sleep, and brain function, weight control, because they're metabolic stimulants. And that's one option. The other options is to use a combination of testosterone injections plus patches. It works for some people. It's a weekly injection of testosterone patches twice weekly. Turns out the price of the patches is on the high side. It runs about $45 a month. Testosterone, not that expensive. But if you multiply that times 4 or 5, you're going to wind up spending about $200 to $250 for the 5 month time interval for the pellets. But with shots weekly and patches weekly, Whereas if you do the pellets, you just do the injection and then you're done for about 4 or 5 months. So it's much more the easy button and much more cost comparative for women than it is for men. For men, it's $650 versus $100, versus women it's $300 versus $250 if you compare like the two methods on that. So the pellets more likely chosen by women. We have men that like, I don't want to deal with the injections, and the pellets, and you definitely have excellent results, and in fact maybe a little better overall in terms of safety than the injections, because the pellets have more of that steadiness, whereas that peakiness of the testosterone in the injectors make a little bit more red blood cells, make a little bit more estrogen, require a little bit more monitoring. So maybe a little more, slightly less safe, but still can be life changing in terms of improving your quality of life and health.
Yeah, I was putting it right here.
That's fine.
You gotta, I never did hit a nerve. I hit a nerve up here one time, in my arm
right.
jump, but then you get around back a little further.
Usually thighs or butt is the main.
And how long are the needles?
It depends on the patient, for intramuscular about that long,
Okay.
about 1 inch,
I think they said the wrong one,
Yeah.
they're like inches.
Yeah.
I don't like that.
Yeah, nobody does really.
Uh-huh.
Thighs or butts, but if it's more than once a week, then that can really be a problem. So people have needle phobia, then the pellets are always an option on that, so you avoid that. Get 4 months free of needles if you don't like the needle aspect of it. I don't think anybody really likes the needle aspect that much, but the results are just so amazing that, yeah, it's once a week, but my life is great, man, it's great, my mood is great, the weight's starting to melt away, I'm starting to get a little stronger in the gym, just the quality of life aspects that really make so much worthwhile that it becomes, the shot once a week becomes relatively minor in the whole picture of things.
Yeah, I was starting to get a 6-pack.
Yeah, yeah,
Look at
right.
Yeah.
And they say
I like to eat, so.
So there's 6, 7 hormones involved in that control mechanism. So we try to get all those optimal. So then, if you do the right stuff, start trying to do the right stuff from diet and exercise, you really start seeing results. The belly fat starts to melt away, the muscles start to pop out there, and quality of life improve.
If you do it too many times, like in the same, not spot, but area, will it make your muscle feel like it's crampy, like a cramp feeling?
It can happen anytime you put a needle into a muscle, you could maybe cramp afterwards, it's possible, but I don't think there's any problem with repetitive use in that muscle, but you got 2 sides, there's other muscles there too. Right?
He likes his left side. I'll take a shot at my right arm, but leave my left arm alone.
Is that right? Okay. So left arm's a
He's
version.
right-handed, that's the
Yeah,
problem, you're right-handed,
I
I
need
get
one
it.
on his hand.
Right butt cheek
That
every
stuff
time.
is kinda thick, so you gotta look.
It is very
Hurts my
thick.
neck.
Yeah, it's
Like,
in
oh,
grapeseed
God,
oil,
Yeah, drop the needle,
so it's very
like, oh,
thick.
shit.
It's from a plant, huh?
It's,
That's it. You
they
got
can
the-
make it from a
it's-
yucca
Yeah,
plant.
that's a yucca plant, right.
Wow.
So in addition to optimizing your hormones, we also kind of give you a program, a personalized diet program, an exercise program. We go over all your supplements and tell you what the best supplements are, for you. And you even recommend an exercise program. And we also have peptides in our office now. If it's more than 40 amino acids, it's a protein. If it's less than 40, it's a peptide. So these are small biologic molecules that are signal cells give each other to tell them what to do. Now we can use their signals to tell us what they want them to do. There are some of them that are still available. The ones you've probably heard about are like Ozempic and Mounjaro, used for weight loss, are actually peptides. So for someone that wants like a significant amount of weight loss, we can potentially prescribe those. There's ones also that kind of help in terms of growth hormone. We have actually growth hormone itself we can prescribe for you if you're deficient, or things that improve internal production of growth hormone, like CGC1295, ipamorelin, or MK677. There's other ones that also help in terms of sexual function or brain function and such like that. So depending on what your desires are, then we can kind of tailor it to you. But I like to kind of really fix the most important hormones at the control panel first, and then kind of move to some of these other options once I've kind of got you at your optimal state.
So that epimorelin, that was the HGH?
Yeah, CGC1295 said ipamorelin. That tells the hypothalamus and pituitary to produce internal growth hormone through their own signal system, as opposed to getting growth hormone externally. So
Yeah.
it's undetermined as to which is better than that. I mean, they're both gonna raise growth hormone. Does using the internal system work any better than taking the external? You know, there's maybe a little bit of a feedback mechanism on that, you know. So I think I skipped on that in terms of the fertility, that there is a potential feedback mechanism for external testosterone. So if you're like less than 40 and you're that reproductive area there where you're thinking, I wanna make more kids, we do have to take that into consideration. You know, there's ways that you can boost internal production without taking testosterone if your levels are not too bad and you're kind of young and healthy. But for most people, you kind of move past the reproductive areas. The best thing is to really take the testosterone, get the problem fixed, and get you to your optimal quality of life and optimal health.
No kids for me.
Right. Well, I don't know. We're never too late. Yes, sir.
What I kind of hit like a wall. I don't know. It was like, this year, maybe last year, where all of a sudden I was not sleeping but 4 and 5 hours a night. I slept fine my whole life. Nothing really changed. I wasn't exceptionally stressed out. And it's like every other night I sleep, and the other nights I don't sleep at all. And then I watch myself gain weight.
Some of the
On a lot of the charts, it's like you see this like taper, but for me it was like I hit menopause or something. All of a sudden, like all of those issues, it's just like I was fine, then it just started.
Usually it's gradual. I've had some people say that, sometimes I have people like after COVID said, oh my God, my system broke down. I've seen some people like that. But usually it's gradual, but sleep, testosterone helps sleep in terms of more restful type sleep. But really, sleep is really critical. That even if you don't have a perfect testosterone level, if your sleep is awful, there's still going to be some issues. You're not going to be quite optimal. But I mean, you have some of the other symptoms of testosterone deficiency. The energy, really critical. Mood, libido. If those things are all down, well, then it's probably testosterone deficiency. And I just like to fix it and see, like, if all that stuff goes away, that would be a home run. That's what I see in my practice. It's a home run, right? Your energy, mood, sleep, and everything gets better. Weight starts to go away. Your sexual function gets better. Like, what medicine does all that stuff? Nothing.
And this wouldn't be related personally to any of these issues, but my whole life I've had really bad pain ever since an accident when I was in my 20s. But got muscle, joint, nerve pain all like my whole body, and just something I struggle with, fibromyalgia. But I know a lot of it is inflammation in my body that I've not been able to beat. But you mentioned inflammation.
Well, definitely going to check inflammation. One of the key numbers I look at in my office, because people mostly fixate on cholesterol, but the good news is cholesterol is not related to longevity. If everybody focusing on the wrong number, it's really sugar and inflammation are kind of the real main problems that cause it. So we look at inflammation very closely. Unfortunately, a lot of people that have degenerative inflammation, where they had like a multiple injuries and their broken bones and stuff like that, although it feels like it's inflammation, usually inflammatory markers are not there, because degenerative arthritis is generally not an inflammatory condition. So, testosterone helps in terms of healing of muscle and tendons, so it's possible you might get some improvement. Growth hormone can help in terms of tendon and muscle.
One thing that has helped me is exercise and stretching.
But that's the best thing, actually.
Stretching.
You're right. Stretching is the best thing.
Well, I stretched my whole life because, when I hurt when I had issues, doctor told me to stretch, and I was surprised at how much it helped my general pain, and so I've just been stretching my whole life. And but I really was too busy to really do any like cardio or walking. And past couple of years, I've just really added walking and light jogging, and it really helped my energy and my pain in general. Maybe it's just
well, I think it's fabulous. I agree with you. I recommend to my patients, some kind of yoga or stretching for that achiness. As we're getting the hormones can also help as far as that goes, but the stretching is really an excellent treatment. And so, but the I don't have time thing over there. We don't do that too much in my office. I've been exercising now for 40 years, right? And there's one thing that kept me going. There's only 3 words, all right? Adam check, no excuses. You don't have to use Adam check.
Just getting there. Well, once you're there.
Glad you showed up.
Yeah, that's it, you know, so many times I could come up with 50 excuses why I'm not gonna go to the gym today, you know? And I'm feeling good, but I still have 50 excuses, you know? But I'm tired, achy, I'm like, no, I don't wanna go, but then I get out, I always feel better. You know, my energy's better, my achiness is better, I feel much better, you know, that kind of reinforces me to go back again and do it again, so.
Just do.
Just do it, right?
Repetition.
Right.
Great. Stay 21 days, great, good habits.
That's right.
Mhm.
And you gotta create
So
this
with the
habit.
HGH, you have that epimorphin, or,
Yep, yep.
okay, so is there another type?
Yeah, well, yes.
Okay.
So there's a couple other options for a growth hormone. You know, this is the oral form, MK677, because not people are wild about 5 times a week injections on that, you know, right?
Right.
And there's also IGF-1 LR3. Now, it's a little complicated because people say, oh, we check your growth hormone level, but you can't. Growth hormone is only present for 5 minutes in the system, so if I check your level, it's gonna be 0. So what we check actually is an IGF-1 level. The growth hormone stimulates the liver to make IGF-1. And IGF-1 has a 40-day half-life in the system, so we can measure that one, it stays around longer. And actually about 2/3 of the action, 70% of the growth hormone's action is through IGF-1, in terms of especially burning